Hi, my name is Dr. Rana Javadaskar, and today I'm going to talk about how infectious diseases are responsible for non-communicable diseases. And this is based on my talk, which I gave at the third International Public Health Conference at Khyber Medical University in Peshawar, Pakistan. So in 1990s, mid 1990s, I went to US at the University of Washington to start my formal education in public health. And then at that time, there was no one interested in doing infectious diseases, work in infectious diseases, except in HIV, which was identified in 1980s. So until that time, people thought that, especially in developed countries, thought that infectious diseases are gone. We have controlled them, we have conquered them, and it's more of a problem of the developing countries or the poor countries. So when I was at University of Washington and I was looking for my thesis topic, nearly everyone was working on cancers or chronic diseases, as we call them, including cardiovascular problems or any other thing. There was not much. There was some infectious disease research going on outside HIV, but the other area was a bigger area. Infectious diseases were HIV. So both HIV and cancers were highly funded research areas for new students. And normally, if there is a funded program, people would like to work in those areas. But at that time, my own idea was that I have to go back to Pakistan, and at there I'm going to have again deal with infectious diseases. So I think I was the only one who decided to do my master's thesis on an infectious disease, which is common in our part of the world, which was typhoid fever, as compared to nearly all of my class fellows who either worked on different type of cancers or HIV. So at that time, the infectious diseases were considered as international issue, as I said. So if you know, at that time, no one was calling, departments of global health. At that time, global health. It was international health. So one is the national problems, your national diseases, and then there are international problems, someone else problem. So in most of the U.S. All those global health department, which are now called, used to be called as international health programs. Similarly, the London School of Hygiene and Tropical Medicine, where I was faculty later, its still name is tropical medicine. It's not our problem, and it's someone else's problem. And I remember in 90, I was, as a Franklin Adams scholar, I was studying at University of Bristol in England, and I got the opportunity to give a lecture to fourth year medical students of Bristol University. And I started my lecture asking them what they think is going to be the major health problem in a country like Pakistan or a developing country. And all their answers were about different infectious diseases, that this disease is going to be a major problem in a developing country or that. And then once they all gave me answers on infectious diseases, I told them, guys, we are humans too. We have hearts too. So our hearts can have problems. We can have cancers. So yes, we have, a lot of infectious diseases, but that does not mean we don't have chronic diseases. And I remember, it was a very interesting talk with the students, but I just wanted to inform my counterparts and colleagues, yes, we body systems don't work in silos. It's not that if you have infectious diseases, you can't have a chronic disease. So you can have both. And I don't blame developed countries of assuming that infectious disease, they have conquered infectious diseases. This was very true across the globe in all developed countries, in US, in Europe, because they have controlled most of the infectious diseases, like simply like this is a tuberculosis graph from the Switzerland, and we have a similar graph of other infectious disease mortality and morbidity from the states, United States also, which shows that by just providing clean water and sanitation and other enforcing health measures, they were able to reduce 60-70% of disease burden of infectious diseases even before the advent of or the usage of antibiotics or vaccinations. So they were very comfortable that they have controlled most of the infectious diseases, and the only problem they have is chronic diseases. This is again a similar TB graph from the States, and if you see, they were very nicely able to reduce the disease burden, but then they got a jump, and the reason was that because diseases were controlled, like tuberculosis was its burden was reduced to tremendous levels, that departments of health started to reduce the funding of those TB control programs. So there were fewer people, fewer resources, and then when HIV came, the health department didn't have people working on tuberculosis, so that we saw that jump of cases of tuberculosis, and then later again, the programs were reinforced and the cases came down. So I think by the mid-90s, pretty much everything on the infectious disease were under control in most developing countries. Developed countries. But the first lecture on infectious diseases epidemiology, which I got at the University of Washington in Seattle, was which I use all the time, is that infectious diseases don't respect international borders. This, even at 1990s, that was what we were taught. So the question was, if they don't respect international borders, how they are not going to come back to developed countries. But at that time, that was not a fashionable thing to ask. The whole this controversy about infectious diseases versus chronic diseases or non-communicable diseases. These are, first it was called infectious and non-infectious. Acute diseases were mostly infectious, and then chronic diseases. But the question, many argue that is this division is real? Can we actually, separate infectious diseases from non-infectious diseases or not? In the beginning, epidemiology was just an epidemiology, and then later, these divisions came into the subject. But this is incomplete classification according to many, and they think that many non-communicable diseases has their origins in infectious diseases, and we will talk more about it later. And some chronic diseases or non-communicable diseases have short duration. Many infectious diseases have chronic manifestations, like recently, the long COVID, after COVID-19, we saw that. And then some other argue that behavioral risk factors can be communicable to whole populations. So where should we put them in? Are they communicable or non-communicable diseases? Even though, they are transmitted from one population to another, and we can talk about it later also. So the segregation of epidemiology into chronic and infectious diseases has led to a neglected area in the public health. The interface between chronic diseases or non-communicable diseases to infectious diseases. So once we separate these two entities, that these are infectious diseases, these are non-infectious diseases, actually we then stopped learning about how they interact with each other. And that is the most neglected part until very recently. I don't say that people are not looking at it, but until recently, it was the most neglected part. So on the heart, we knew about these issues like endocarditis. This we knew before COVID-19, pericarditis. We knew about some chronic diseases which have start an initiation from the infectious diseases. But recently, in a new study, we have been told that even pneumonia and urinary tract infection increases the risk of coronary artery or a sudden heart attack in the next 3 months after your recovery. So think about it. You have a UTI, urinary tract infection, and either you have a pneumonia, You are not going to, there are chances that you go die because of this disease, but also there is an increased possibility that there will be a sudden heart failure or heart attack, and that increases your mortality in traditionally considered non-infectious diseases like heart diseases. So after the COVID-19, the interface between an infectious disease and its chronic disease consequences is becoming more clearer day by day. And, so let's talk about the heart, the COVID heart, which recently, again, very recent study which came and has told us that even after 1 year of SARS-CoV-2 infections, patients have a high cardiovascular disease risk. And who thought that infectious diseases could be responsible for abnormal heart rhythms, blood clots, strokes, myocardial infarction, and heart failure? And these cardiovascular problems are true even for those who had a mild COVID-19 infection and they were not hospitalized, but an infection, a viral infection, has basically played a huge, has damaged their blood vessels, that the major heart problems or circulatory problems, the risk goes up even after 1 year of the recovery from the recovery of that viral infection. So similarly, when we talk about diabetes and infection relationship, we knew certain things even before the COVID-19 era, that it increases the risk of type 2 diabetes, bacterial infection and diabetes can have, they can do also increase the insulin resistance, and bacterial flora plays an important role in development of diabetes. But COVID-19, after COVID-19, and the research which went into, we are now pretty much confirmatory studies that COVID-19 infection put you at a higher risk of new onset diabetes and also type 2 diabetes. This is just a graphical representation of the pathways that how a viral infection could put you at a higher risk of diabetes. As I said, a lot of research has been made possible by resources available on the COVID-19, that now in a very short time period, the interface between an infectious disease and the chronic diseases, which were called at that earlier, their interface is becoming more clearer and clearer. For example, in respiratory system, we see that after COVID-19 recovery, and these are long-term, I'm talking about long-term effects, that you can still have low oxygen levels in your blood, you can still have a shortness of breath, and you have a persistent cough. And I can give you my own example. I had just once a mild COVID-19 infection, and 6 months after recovery, I realized that I was walking up the hill, that I'm losing my breath, and I normally walked 8 kilometers a day on average. So for me, that was a big warning sign, and after that, I decided I need to fix that by slowly, slowly increasing the exercise level, which I normally do. But, and I had a very mild infection, I must say that. And then in nervous system, who thought that memory problems, headaches, and the risk of stroke could be a consequence of an infectious disease? We never thought about it. We have, if you think about etiology of a stroke written in the books of medicine for medical students, they never talked about an infectious disease can increase the risk of stroke or your memory problems. I don't remember reading that by the time when we were studying. Similarly, I don't think I remember, reading about mental health and thinking about when we are discussing depression, sleep problems, anxiety, and even substance abuse, that they could be the consequence of a viral infection. I don't think any medical book has ever mentioned that interface. Similarly, we have already talked about diabetes, but obesity, where, in which medical book or book of medicine it was mentioned that you can have a high cholesterol and obesity after recovery of a COVID-19 infection. Then now moving to the cardiovascular system, we have already talked about it, that acute coronary diseases, failure, heart palpitation, again, these were never considered uh, uh, infectious disease consequence or sequela. Let's move to the gastrointestinal system, constipation, diarrhea, acid reflux. Even we are not talking about acute episode, we are talking about after recovery, that you have a consistent problem of these things. Similarly, on again acute kidney failure, injury, and chronic kidney disease, which may require dialysis because of COVID-19 infection, and then coagulation regulation, blood clots in the legs and lung. And again, giving my own example, I had like fever for 2 days or 3 days, and my, oxygen levels stayed very nicely when I had the COVID-19 infection. But I noticed after recovery that nearly all of my nails have petechial hemorrhages, small hemorrhages under the bed of each of my hand, nails. That shows the devastation the COVID-19 can cause internally in your different body systems without showing you or giving you a severe disease. So that's a very dangerous part of, again, COVID-19, and also it and that's also some explains some of the health consequences of our problems of cardiovascular system, which comes apparent later. Similarly, rash, skin, hair loss, joint pains, muscle weaknesses, malaise, fatigue, and anemia. But remember, in acute episode, we do expect to see certain problems, but we never expected that these could be long-term consequences of an infectious disease. And only it became apparent to us because a lot of research has gone into COVID-19 and its long-term consequences. And studies were published at a faster pace also. So resources were available, attention of the decision makers was there, and the publication of those studies were on a faster pace. That's why in that short time of period, a neglected interface between infectious disease and chronic diseases become clear to us. This is again just a collection of whatever we have discussed, that how a viral infection can affect your all body systems. It's not just respiratory diseases, it's not just cardiovascular diseases. It could affect pretty much all the health systems. There are multiple infectious agents which we know causes cancer, and I will talk more about them later. So if I, instead of going into each one's detail, for you to remember is this, that 90% of all cervical cancers are caused by a virus. Simple as that. 60% of all liver cancers are caused by a virus. Similarly, leading cause of childhood cancer deaths is due to a virus. Helicobacter pylori, not a virus, but an infectious agent which is responsible for duodenal ulcer, gastric cancers, and lymphomas. So these are like four major players of so-called chronic diseases or non-communicable diseases, cancers, which are initiated by a virus or an infectious agent. So we need to remember this thing. that human body does not work in silos. Different health, body systems do not work separately. As I mentioned earlier, that this is our nervous system that's working in isolation of respiratory system, and which is working separately from your cardiovascular system. So all they are interlinked systems. So our health is also affected by not only what is inside our body, but what is in our genetics, what is our behavior, what is the environment, what is the physical influences, and what is our access to the medical care, and including social factor like socioeconomic status also. So health is not just internal body system; it is affected by many external and internal systems also. According to World Health Organization, health does not mean that you don't have a disease. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And we need to think holistically. The human body is comprised of a lot of complex systems which are interdependent on each other. So they don't work in isolation. And that's important to know when we try to divide diseases into communicable and non-communicable diseases. No, infectious diseases, as I have shown you, can create problems and can create the similar problems of a chronic disease, or even initiate chronic diseases later on. So what to do? Recently, I have written an article about Pakistan health system, and the title is Rising from the Ashes. But that's true for all the health systems, especially health systems in developing countries, and I would say even in the developed countries. Number one, we need to address the cause and not the symptom. So currently, what is happening, the symptom is that we have too many patients for health system to cope with them. In developing countries, there are, on one hospital bed, sometimes there are two patients lying because there are not enough beds. For a health minister, the simplest solution is to build more hospitals, increase the hospital bed numbers, so people can be treated properly. In the developed countries, it's more to provide access to the healthcare, and that's considered the solution of the healthcare problem. But this is not the cause. The cause is that we have too many patients. So you have to address this in developing countries, especially to focus on preventing people from getting sick. And this you could do it, especially in developing country, by just giving clean water and sanitation. And we have seen that developed countries have reduced 70 to 80% of infectious diseases before the introduction of antibiotics and vaccines. So we could do the same. So once you have the reduction of 80% of infectious diseases, that means you have more resources to address the non-communicable diseases. Not only you have more resources to address the communicable diseases, the communicable diseases will be also have a less burden, because those non-communicable diseases which were being initiated by infectious diseases, their number will also go down. So overall, you will have a better manageable health system which you can do with lower resources. So that's the only way in which we focus on prevention than providing health care. But until now, around the world, both developed and developing countries, the solution in the health systems failure, after the health system failure, is that just to increase the hospital bed, just to improve the access of the hospital care, there is less resources, there is less focus on how to prevent people from getting sick in the first place. I thank you for your time. Goodbye.